Warm greeting. Myself, Dr. Sunil Natha Maske, working as Dean and Professor Pediatrics in Dr. Vithalrao Vikhe Patil Foundation's Medical College and Hospital, Ahmednagar. Today, we are going to discuss a very important topic, that is the next exam. Next means National Exit Test. This draft was just released by National Medical Commission and was put forth in front of the dignitaries. At present, the MBBS curriculum is, after passing the third major MBBS, there was a university exam. After that, internship 1 year was compulsory for all the MBBS graduates, and after the completion of internship, the certified doctor with MBBS degree was awarded. And those who are interested for the post graduation, they have to give the NEET examination. So after giving the NEET PG exam, they will be selected for the post-graduation, and after completion of 3 years, the postgraduate degree was awarded. But according to the next exam, in short, after completion of MBBS final year, the student has to give the next one phase exam. Then they are eligible for the internship. And at the completion of internship, again there will be next two exam, and by clearing that exam, they will be called as a certified doctors. Remember that in this new draft, there is no FMG or MC exam, no NEET PG exam. The next exam shall be implemented and rolled out in the year 2023 and shall act as a replacement for the FMGE exam as well as the NEET PG exam. The National Medical Commission Bill is considered a big milestone that shall be a major step towards improving the medical education system of the overall country and overall the Indian healthcare system. There is no official announcement that has been made about the conducting body of the examination yet. But according to some media reports, the National Board of Examination will conduct the exam across the country. The aim of new medical bill is to start a single window exit exam for final year medical students. Once the government implements the new law, there will be only one exam for final year degree, medical practice license, and medical PG entrance. That means for these three problems, there will be only one solution, that is the next exam. The objective of this exam, according to the Ministry of Health, the main objective of the next exam is to improve the medical health system of the country and produce more talented doctors, point that have been mentioned above. This is also the first step toward the government's aim to ensure their one nation, one exam plan for all the students of the country. Additionally, the next exam for MBBS graduate will also help the government fulfill three other objectives like filter unqualified students, second, act as a single official licensed exam like the FMG exam, and third important, it will also act as the official postgraduate examination which is replacing the NEET PG exam. Therefore, only those candidates passing the next exam will be eligible for a medical degree in India. In fact, even foreigners, medical graduates from other universities, they have to clear this exam in order to be eligible to register themselves to work in India. Those students who have got good scores in the national exit exam can get admission in medical PG courses offered by the medical colleges in the India. There are advantages of this next exam pattern. The next exam medical will ensure an equal and standardized education system throughout the country. Second advantage, that's because it will be a pan-Indian exam that will compulsorily have to be followed by every state, including the same education pattern for medical study as well. In fact, it shall also ensure an equal and uniform standard of education. Currently, the medical colleges of Karnataka, Punjab, and Delhi are considered to be the best, but thanks to the next exam, Other state will also come at par as well. And very important thing is that by this next exam, colleges will enhance their education level as their students will prepare for the uniform examination. In a way, it will force or pursue medical colleges to enhance their education level as their students will have to compete with foreign medical graduates in the same exam. Overall, it will lead to an enhancement of medical education in the country as the president's signature on the bill will make it a new law that will force many to enhance the quality of medical education in the country. This will also lead to India following the same education or a similar education culture as the developed countries do. This shall be a unified exam where they will appear alongside the Indian students. Now, next very important question, what is the eligibility for this next examination? First, a valid MBBS, that is undergraduate degree. Second, they must have passed their MBBS course with a score of at least 50% marks. Third, apart from this, students also need to be understand that after passing next paper 1, they are required to take a mandatory clinical internship of 1 year. And last, it's only after completing this internship that students are eligible to appear for the next paper 2. The exam pattern of the next. First, the next paper 1 will be an online multiple choice question, that is the MCQ exam, that will have a total of 540 questions. And in this exam, only those passing this exam will be eligible for internship program. Marks for this paper are eligible for next 2 to 3 years. Second part of this exam is the paper 2, which is a fully practical exam. According to the latest developments, this paper will be image based. It's only after passing this exam that candidate will have the option to either pursue a PG in medical education or practice medicine in India. There will be total 6 sessions with 2 being held up per day. Important points of this next exam. The exam will be conducted in 2 parts. Just we have seen next one and next two. Students will take next one exam after their final year exam. First part of exam will be MCQ based, that is a multiple choice questions. Total 540 multiple choice question will be in question paper, whereas next two exam will be organized after internship by the university and it will be of practical oriented. In short, this next exam will start from 2023 December, mostly conducted by the National Board of Examination. After passing final year exam, candidate is eligible for this. It consists of 2 papers. In paper 1, the detailed schedule will be like this. On day 1, pre-lunch, there will be medical, that is the medicine and allied subjects of 3 hours duration with 120 items. Post-lunch, there will be pediatric subject of 1.5 hours with 60 items. On next day, there will be pre-lunch session of surgery and surgery allied subjects of 3 hours duration with 120 marks. And post-lunch, 1.5 hours ENT of 60 items subject will be there. On day 3, pre-lunch will be obstetric and gynec of 3 hours duration with 120 items. And in the afternoon, post-lunch will be ophthalmology of 1.5 hours for 60 items. The question pattern of National Exit Exam Paper 1 is expected to be divided into 3 important parts. There will be total of 540 multiple choice questions in the examination. In this 540, 60% of the question will be to test the problem solving skills, 30% questions for comprehension and analysis, and 10% will be of recall questions. After passing this next one phase, student will start their internship. Those who manage to pass the theory, that is the next one, they will have to clear the next two, the practical test separately at the end of internship. The score obtained in the next one will help to gain the PG seat after internship. Remember that the score in the next two examination will be in the form of either pass or a fail. Students scoring well in the National Exit Test Paper 1, that is those clearing the paper, are eligible for an internship. After the said internship, respective university shall only conduct the next two examination. However, it's important for the student to know that in case one fails the next paper too, they have to wait for one whole year, as the exam will be annual exam, hold only once in the year. However, there is no need to worry, as the next one paper score will be valid for next 2 to 3 years, and students have to pass the second part of the national exit exam within that deadline. This means that even if someone fails in next paper 2 and needs to repeat their attempts, their next paper 1 score will be valid for paper 2 for the next 2 to 3 years. This is the graphical view of this whole next examination. After final years, next one exam. If pass, internship will start. If fail, again they have to give the next one examination. After completion of internship, they have to prepare and give the next two examination. If the student pass, he will be permitted to practice, or he will go to the post graduation. If he fail, he is not permitted to go to the post graduation, or he is not permitted to practice in India. The syllabus of the next exam will be pretty similar to the medical syllabus of India. With good knowledge of basic concepts, students will crack the exam easily. The final year syllabus is not enough for clearing the exam. Students have to cover the previous year's studies and concepts to perform well. Also, students have to get the good practical knowledge, because PG admission will be invited through the exam. Next two will be a pass or fail type of exam, that is the qualitative exam. Next one will be quantitative exam. Marks in next two will not contribute to PG seat allocation. Just I have told, next one phase marks will be quantitative, that will help in the PG seat allotment. Thus, next one will be a qualifying as well as competitive exam. There will be unlimited attempts in next examination. Score of next one exam will be valid for 2 to 3 years for the purpose of PG entrance ranking. To summarize this next exam, which is going to be held at the end of this year, the batch which admitted in 2019 and afterwards, they will have to give this next examination. In short, next one examination for MBBS will be held for 3 days. Just we have told pre-lunch and post-lunch session. The examination paper for next one is divided into 6 parts. Every day consists of morning pre-lunch and post-lunch session of 3 hours and 1.5 hours respectively. Next one exam will contain MCQs, whereas next two will be an oral and practical examination conducted by the university. Next one will be online procured exam, whereas next two will be offline exam. The total duration of exam will be 13 hours and 30 minutes, 4.5 hours per day. Important to note that there is no limit of attempts for this next exam. Next one exam is a quantitative exam, either in scoring the marks will help in the PG admission. Next two exam will be qualitative exam, either pass or fail, that will help in practicing in India as a medical graduate and for green signal to take the admission in the post graduation. Thanks a lot.